about you talked about how certain buildings should be remediated, but what's the timing of that? Because if there's an opportunity for repeated exposure, it seems to be just contaminated again. So how should people be thinking about this?
So that's a great point, and I would say I would kick it to Dr. Haynes too in a second, because she's looking at that long term. So I'm in agreement that repeated exposures occurred. It wasn't just the chemical fires and then it blew away and disappeared. There were repeated exposures for certain people in the community in certain locations in the community. And so that's the complexity that we need to see things through. Not that all buildings are safe or all buildings are unsafe, but that there's this, what's the question you're trying to answer? And then let's get the data to answer that question. And generally what you see after disasters is people say things and sometimes there's no data to back it up, except the agency exists as an agency. And so then it's flipped. Well, if you're going to show something is not true, you need to come up with the data, not us. So I would say that we need to work through this and understand that there's different experiences for different people. People 10 miles away from the site did not have anything like the experience that people along Sulphur Run or the derailment site had. And this complexity needs to be acknowledged and understood. Sometimes one last thing is agencies work to make it simple for people to understand, but by doing that, they basically take out their ability to communicate in an effective way with the population that's harmed and understand these nuances. And so communication is key too. And we've seen that many mistakes over and over through this disaster by multiple agencies communicating in ways that wasn't necessarily backed up by the data. There's probably the message was twisted by the time it went to the public, and therefore that's why people can be confused.
Erin, anything to add to that?
No, I think that's fine. The community deserves and needs long-term follow-up and care, and a health study needs to be launched, and large one. What I did was small, and I apologize to all of them. Actually, I'm sorry this is so small. I wish it should be large. 20 people is not enough, but I'm hoping that this small piece can then be, we're going to share the data right away as soon as we get information, and then it can be used to spur on larger resources if warranted.
Molly, you raised that issue as well about the lack of a comprehensive sort of database being established right at the very beginning. And then Erin is just pointing out that theirs is very small. I mean, how do we reconcile this need?
I mean, I think it's how do we reconcile it? I don't know how we reconcile it, for this situation at this point. I mean, honestly, there needs to be intervention and government support to expand on what Dr. Haynes has already done, again, and to set it up for long-term monitoring, right? And so when we talk about some of these prospective studies, they need to run for over a decade, if not more, to see and answer things, especially for diseases like cancers that are called long latency diseases. They take 10 to 15 to 20 years to develop, right? So where we've seen this done well, for example, there was a horrific incident in Seveso, Italy, that was in a pesticide manufacturing plant that spewed dioxins all over that community. Well, what was possible there is very soon after, days after that event, they had biomonitoring samples from many of the residents in the community. What that allowed for are long-term studies years later that were able to look at difficult questions that are very hard to do if you have to recreate exposures, right? What's very hard to do in these kind of situations and studies is to recreate an exposure scenario. We use surveys and we have all sorts of problems, with recall bias of what people remember their experience was. Well, when we can document that first and foremost during an event, either through a survey or through biomonitoring samples, we bank those. And then we have them available to look at once we start seeing kind of diseases starting to accumulate. So I feel that we have to establish this infrastructure. We have to do it for this community, but we also have to say this is a lesson learned. These types of disasters are going to happen again. Why we need to set up these kind of systems of infrastructure to support research going forward. And again, CDC and ATSDR intervened in the 9/11 event to support this. So I think we need to encourage these agencies to support that level of funding and long-term support, going forward for this community and others going forward.
Thanks for that. One of the other issues that occurred to me as I was listening to the first panel and learned that the majority of people in some of the nearby communities, not all of them, but some of them are on private well water. And we know that it's likely that groundwater has been contaminated, and we know the plumes are moving. So what sort of long-term monitoring should we be thinking about and residents be thinking about in terms of water contamination? One of the earlier panelists said, well, they've gone back to bathing in their well water, but not drinking it. What sort of monitoring should be going on with groundwater contamination for people to be reassured who are on well water?
Andrew?
So I would say that there's a couple things. First is we need to recognize what the contaminants of concern are, and then we hunt those down through the groundwater and track them. And as last lines of defense, the homeowner tests their own well, but we should be tracking it. So our hydrogeologist should already have been engaged by the US EPA and figured out along Sulphur Run and Leslie Run where the water is gaining stream and where it's leaving the stream, so that people near that area can understand where their groundwater is affected. That hasn't happened yet. And so that's why there's a lot of questions about private well water safety. But that's easily understandable and fixable. It just has to be done. As far as transformation products, some of these chemicals can break down in groundwater by the microbial populations and transform into other things. Tiobutoxyethanol, for example, transforms into something else. And so, what are agencies thinking about from a long-term monitoring plan? Is the list of chemicals that they're looking for now appropriate or not? And there really hasn't been a lot of external scientist evaluations of that. It's been more of a, here's a plan, put it out there for the public to see, this is how it is. So I would encourage engagement on this topic.
Yeah, at 6 months, that seems like a really large shortcoming. I mean, the groundwater contamination was going to be an issue right from the very beginning. Erin, I'm wondering about these wristbands that and the other things, the other monitoring things that you've put up in the town. And you mentioned that you were going to send them to North Carolina for, I think you said dioxin and dioxin-like compounds.
Yeah.
Are you looking for other chemicals besides?
So, we all wish there were one device you could wear and it captured every chemical under the sun and its little, every chemical it broke down into, its breakdown products. But every chemical requires its own device, especially for air. And so the wristbands are very easy to wear. They're simply like the Livestrong, wristband. They absorb chemicals, and they're funded through the, it's called the HERE program. NIEHS has the HERE program. It's Human Health Exposure Analysis Research. And Dr. Heather Stapleton has a laboratory funded under that mechanism to be able to explore novel, innovative devices for exposure. So the wristband is part of that enterprise. And she is going to, it can do many chemicals, it can do pesticides, but pesticides wasn't the focus of this issue. So we're focusing on PAHs, which are polycyclic aromatic hydrocarbons, burning, combustion, organics, and then also dioxin is something else that she can measure. Now, I'm not confident. I don't know that I'm a little, I told the participants too, I don't know that the wristband itself will be able to capture dioxin from the air. That is, it has to be at higher levels for this wristband to get, but we're trying. It's like, let's just try. It's almost like throwing the spaghetti out and seeing we're giving it whatever we can apply to the community where I want to enable it. The little passive badge would be more specific to very targeted chemicals associated with the derailment, the burning. So very targeted. That's another analysis. All right, we're trying it to do is, again, answering Dr. Welton mentioned, what are those chemicals? What are the targets? And then once we collect this preliminary, we'll be able to, I say, run.
Thanks. There are several questions in the chat about dioxins and dioxin-like compounds and how they're being looked for, and are they being looked for in the soil, and then of course in people's blood and so on. As far as what you know about the dioxin monitoring programs, whether it's environmental or biomonitoring, what can you say about the adequacy of it and the findings so far?
No data so far. The samples have been collected. Thank you to the participants who gave you have to get quite a bit of blood to get enough serum to be analyzed. So they were real troopers. It's being analyzed now, in fact, this week. So I can't say anything about the data because I don't have it.
Andrew, you had mentioned you had some new data, but is there anything you can share with us now that you're willing or able to share with us now?
Well, I think some of it is in that PDF presentation, which shows that the indoor air testing was incapable of finding all of the acute health risks. And that could probably account for some of the illnesses that people reported experiencing after they went into their buildings that were tested and claimed to be safe, but they may not have been. We do have additional data in that list of activities, but we're kind of wrapping up some loose ends here, and hopefully in the next month or so, be able to come out with it all.
Another question that came up in the chat is about the regulatory agencies that have been engaged here and the adequacy of their responses. And I'm wondering if you've noticed differences between the response by the US EPA and the Ohio EPA as they've engaged in this and their relationship with the company and with scientists.
I want to say that every agency has its role and its job. And I know the EPA on site has been there and working nonstop and they are the only agency that's EPA has been on site this entire time.
Do you mean the federal EPA? Erin?
No, I think it's Region 5.
Yeah, but it's not the Ohio. Okay.
Not Ohio.
Yeah.
No, I don't.
Okay.
Yeah. No.
Okay.
No comment.
Okay.
So I would say that with disasters like wildfires, or you have an infrastructure that's destroyed, and counties work together and communities work together in government agencies, but it's not generally just a government agency show. Where you have chemical spills, sometimes you have a principal responsible party that caused it, and then you have the agencies as well. And so the most critical aspect of a disaster response is the early part. Because why is because everything's up in the air. Nobody really knows anything. They're looking for advice. They're looking for feedback. They don't really know what the health risks are. And that's generally when you want to get in and help people in a way to help them square up or think through these decisions. And so there's been a lot of mystery behind what happened and what discussions happened in the early days of the response. And we kind of saw that kind of percolate out 3 weeks later when we saw that, the drinking water wasn't being tested for some of the chemicals that were spilled. And so a lot of the plans were done behind closed doors, and we don't really know why that is. But I would say it's important that now is a good time to pivot for this disaster and embrace the complexity and embrace the public health protection and helping the community emerge out of where it is in a positive way.
If I could also add to this, what was striking to me very soon after, days after this event, I remember, going around to just Googling around to all these disaster response plans that are out there, are available. They were developed by NIOSH related to response workers. They've been developed by CDC and ATSDR in relation to community response. What just kind of scratches our head is that they weren't followed. And so, like in the case of the World Trade Center disaster, it was the New York City Health Department that stepped up and originally started kind of the response around health effects and health concerns. And, you didn't see that here. There was definitely responses from the health department to kind of go talk to your primary care provider or call, this number if you're concerned, but there was no real disaster response to kind of set something up for the future. And those plans, those protocols are out there, but they weren't followed. Maybe newer staff and officials are around and aren't aware of all of that has been developed in the past, but we didn't follow it in this circumstance.
And I will just add one thing about that. It's endemic to the educational system and industry as it is today. We do not train people to operate in the unknown. We train people to do a job with certain skill set. And when you have disasters, you need people that are comfortable trying to figure out how to navigate. You need people also to know, oh, there's an IOSH plan for this, there's this. Oh, we need to start health monitoring. Oh, we need to do this. We don't generally have that type of expertise coming into these agencies and communities. And so people many times don't make decisions because they're doing it in a different way. They just don't know. And that's sometimes how we can get so far down the road without answering some basic questions.
Well, thank you for that. This has been a rich discussion. I think back to when this disaster happened, and I learned very quickly what chemicals had spilled because there was a manifest that was released publicly. And so I was familiar with some of them, but not all of them. And it didn't take very long to dig out, as the previous panel mentioned, what do the data sheets say about these chemicals? And they say exactly what community members were reporting. And we heard it in the first panel: skin rashes, the respiratory irritation, the wheezing, the nosebleeds, the eye irritation, and so on. And it was all right there. But sadly, the first communication that was coming out was telling people that now the danger had passed and things were safe. And now we're learning 6 months later that things are not safe. And we know that we need a more prolonged response to this disaster. It's going to go on for a long time. And we wish the people on East Palestine and the surrounding areas all the best. And we're thinking of you. And we'll continue to follow your story and hope that this does not happen again. But as we also heard, it's likely to, because every 3 days there's a train derailment. So with that, I think we need to end this panel. Thank you very much for attending, and I'll turn it back to Deborah.